morning, happy Saturday. I am about to go see patients in the hospital, but I wanted to quickly share a couple of new guidelines on genetic testing that NCCN just put out. So NCCN is the National Comprehensive Cancer Network, and a lot of the guidelines come from NCCN, and insurances, that's kind of their gold standard. They will quote those guidelines if they want to deny something or approve something. What did they do? First thing that they did was align with ASCO guidelines in terms of the age for genetic testing for breast cancer. So earlier this year, ASCO, the American Society of Clinical Oncology, said that every woman diagnosed with breast cancer age 65 or younger should be getting genetic testing, regardless of breast cancer subtype or family history. And so now NCCN actually also changed their age to align with ASCO, and it also is 65, which is great because it'll allow for more coverage. The other thing that they did in breast cancer is that they said, well, if you can't test the person who had breast cancer, you can consider testing their unaffected family members if they meet criteria. And sometimes insurance companies would deny the testing for the family members, and so they expanded that to basically say even if you can't test the person who had the breast cancer, the family members, the unaffected family members, should be eligible if they meet the criteria. So I think it will broaden a little bit of what insurance will cover. The next thing that they did was say that all women diagnosed with endometrial cancer should be getting genetic testing. This is a huge change. And so if you or someone you know has been affected by endometrial cancer, definitely reach out to your doctor if you have not had genetic testing, and to decide if that's something that you should do. So going forward, everyone with a new diagnosis of endometrial cancer should get genetic testing, but we also want to make sure that people who were diagnosed in the past have that conversation with their doctors about what if they should do that. And in the last change that they made is for patients with a CHEK2 genetic mutation. We used to think that if you had a CHEK2 mutation, there was a higher risk for colon cancer, and so you were advised to start colorectal cancer screening earlier than what is recommended for the average risk patient. And they actually changed that, and they said there's actually not an increased risk, and so they de-escalated those requirements, and people with CHEK2 mutations would start screening just like an average risk person unless they have other risk factors. And remember, colorectal cancer screening for an average risk adult should begin at age 45. Let me know your questions on these changes or anything about genetics. Leave them in the comments.